How do placebo effects evolve after clinical trial unblinding? Imagine you are part of a clinical trial, and you have been taking a treatment that you believe will help your condition. Now, what happens when you find out whether you received the actual treatment or a placebo? This moment of unblinding can significantly change your experience and outcomes. First, let's talk about the placebo effect. This is when a patient feels better simply because they believe they are receiving an effective treatment, even if it is a placebo. It shows how powerful our expectations can be when it comes to health. In clinical trials, blinding is used to keep both participants and researchers unaware of who is receiving the real treatment and who is receiving a placebo. This helps to reduce bias and ensures that the results reflected the treatment's true effects. Unblinding occurs when participants learn which group they belong to. This can happen during the trial or after it has concluded. After unblinding, the placebo effect can change in a few ways. One possibility is the nocebo effect. This is when participants who discover they were on a placebo may start to feel worse due to negative expectations. This shift can lead to a decrease in the benefits they previously reported. Another aspect is the change in expectations. Once participants know whether they received the actual treatment or a placebo, their views on the treatment's effectiveness can shift. This change can influence how they perceive their symptoms and overall health outcomes. The psychological impact of knowing the treatment allocation can also be significant. Participants may feel a loss of trust in the research process or become hesitant to join future studies. This can affect their overall experience and willingness to engage with their healthcare providers. For patients considering participation in clinical trials, it is essential to understand these dynamics. Informed consent is crucial. Patients should be aware of the potential for unblinding and how it might affect their experience and outcomes. After unblinding, patients may require additional support or counseling to address any psychological impacts or shifts in treatment expectations. This support can help them navigate their feelings and maintain a positive outlook on their health journey. Understanding how unblinding affects placebo effects can also guide patients in making informed decisions about future trial participation. By being aware of these factors, patients can better manage their care and expectations in post-trial life. In summary, the evolution of placebo effects after clinical trial unblinding is a vital aspect of the patient journey. It highlights the importance of understanding how expectations and beliefs can shape health outcomes, both during and after clinical trials.